Excellent. Well, hey, thank you everybody for joining the HIPAA Proactive Security and Compliance Best Practices webinar and discussion today. My name is Mark Dahlmeyer with Exceptional, and I will be the host and the presenter for today's session. We've got a lot of ground to cover, so let's jump right into the conversation. So according to Black Book research, over 90% of the healthcare staff working remotely during COVID-19 did not receive any security guidelines or data privacy training before going remote. So this Black Book research covers a wide variety of survey questions. We have a link to this research in the presentation that we will circulate after we publish this webinar, but it is very interesting reading if you're in the healthcare industry. Now, at the same time, in 2020, the number of healthcare industry cyber attacks in the US increased over 45%. Now, some countries like Canada and Australia experienced cyber attack increases above that, close to 100 or even over 250%. Now, as of September of this year, cyber attack frequency and cyber attack severity has not slowed down. It's actually increased. In August of 2021, there were 707 healthcare data breaches that have been reported for the previous 12-month period. Now, when you compare that to 465 data breaches for the same time last year, this is a significant amount of growth. We all know HIPAA compliance was created to help protect customer health records and customer health information. But the reality is, a lot of healthcare organizations and business associates struggle with data privacy and security. So in today's session, we're going to talk about the healthcare industry cyber attack trends. We're going to talk about regulatory compliance, and we're going to talk about how to deploy some proactive IT and security best practices for addressing the large tsunami of cyber threats and attacks and HIPAA compliance. Actually, since January of this year, over 38 attacks on healthcare providers or systems have disrupted patient care at over 960 locations, as compared with 560 sites being impacted across 80 separate incidents in all of 2020. So again, what we're seeing is large number of attacks. The attacks aren't slowing down. Significant numbers of breaches being reported. So how do we get ahead of this? Before we jump into how we get ahead of this, let's talk about why is healthcare under attack? Well, healthcare happens to be the largest industry within the United States. It actually represents over 17.8% of the GDP for the country, about 3.6 trillion in spend, and there are an estimated 784,000 organizations within the industry. So not just healthcare providers, care providers, hospitals, clinics, etc., but business associates. So vendors, partners, manufacturers that support the healthcare industry make up that total. It is a growing global market. So global spend is estimated at about 10 trillion by the end of next year, and the compounded annual growth rate for the industry is over 7.3%. There's a vulnerable supply chain. So as part of that 784,000 organizations that service the industry, those organizations are predominantly made up of small to medium-sized businesses. So they can't invest heavily in technologies for security or compliance or data privacy related programs. So they're more vulnerable than other organizations. And if you look at the data from this year from the federal government, business associates, so third-party suppliers and vendors to the healthcare industry, now account for 43% of the breaches within healthcare. The value of data, personal health records, personal health information, and electronic records can fetch extremely large amounts of money on the dark web. So, and when I say that, I'm talking about somewhere between $1 and $1,000 per medical record. And it really depends on how much information on the individual is associated with that record. If you have a full medical history and a social security number and a credit card number and personal identifiable information such as home address, right, telephone number, etc., driver's license number, then that record could fetch up to about $1,000 on the dark web. Why? Well, because cyber criminals globally can leverage these records to commit pharmaceutical and medical fraud. So they can purchase illegal pharmaceuticals online via the dark web. They can commit medical fraud. And so there's a huge criminal syndicate that's been established and a huge hacker set of syndicates and groups that have been established to facilitate the theft of medical research and medical data and healthcare information, and then perpetuate fraud on the dark web. So, and again, this was published in HIPAA Journal recently, there's been a major increase in the number of cyber attacks on business associates, not just last year. This has been going on for a number of years, and we'll get into this. But again, the BAs now account for 43% of all reported healthcare data breaches. In the first 6 months of 2021, there were 141 data breaches reported by business associates that are supporting HIPAA-covered entities or care providers. So again, this is significant. Here are the healthcare industry realities that we're all dealing with. And a lot of these realities have been communicated and bubbled up in the media since the beginning of COVID, of the pandemic, which is important because for those individuals that don't operate or service the healthcare industry, they might not understand and know the realities that the healthcare industry is working within. So we have staff that are mentally tired, they're emotionally tired. The majority of staff are overworked in the industry, and there is a massive talent shortage within the industry. So we have a spike in demand because of pandemic, and we're dealing with staff who are already mentally and emotionally tired and overworked, and then we have a shortage. But they're also dealing with information technology, information security, and operational realities, such as they have legacy or old technologies and unpatched and unsecured systems. Now, some of these systems are new. Maybe they're IoT based, or maybe they're connected to the internet. But a lot of these systems, especially in acute care or specialty care, they cannot be taken offline to be updated and patched. So they, from an IT perspective, they need to be partitioned off from other parts of the network. So because they save lives, right? That's their core function. So we have legacy and unpatched software applications, not just systems or devices, but actual software. And some of this software is embedded within medical devices. And these medical devices are constantly being used. So, and they're in short demand oftentimes, depending on the care facility that you're in. So you just can't take devices offline and spend days or weeks updating these medical devices from an application system or from an operating system perspective. You have the growth of IoT or internet connected devices within care facilities and throughout the healthcare supply chain. And the number of vulnerabilities within IoT devices has been very well documented and very well covered in the media and in the industry. You have a growing threat landscape, meaning you have facilities, clinics, now you have new telehealth delivery systems for healthcare. And especially in the telehealth situation, you now have healthcare being provided to consumers, individuals, right, or businesses at large through personal devices that may or may not be secured. As facilities and remote clinics come online or get integrated into a large care network, you have a wide variety of vulnerabilities and security programs and security postures and data privacy programs that need to be integrated. So this creates a large growing threat landscape within the industry. We for 25 years we've been talking about the lack of IT or the shortage of IT talent within the US. There's almost a seven-figure IT talent shortage in information security right now. And then, of course, we have we have understaffed operational team members and organizations, and then we have unsecured third parties or business associates that we've been talking about. So when you take a look at these realities, this creates significant risk for healthcare organizations. And when you take a look at HIPAA and the regulatory compliance structure and the Health and Human Services Department that's governing that within the US, there's a significant amount of change, and there are constant updates, not just to HIPAA, but other state and international data privacy regulations, such as GDPR, such as PCI for credit card processing and handling, such as the California Consumer Privacy Act, which is about consumer data privacy. Now, Thomson Reuters did a very large study on this in 2019 and 2020, and they published their research, which says managing regulatory compliance change was reported as the top challenge last year. 34% of all companies reported that they're outsourcing some or all of their regulatory compliance, up from 28% in 2019. And can you blame them? Again, with the amount of staff dynamics and operational dynamics at play here, many healthcare organizations and business associates just don't have the time, the resources, or the talent available to invest in running and managing and maintaining regulatory compliance and staying ahead of cyber threats. If you ever want to get a glimpse into the rate of regulatory compliance change, go to reginfo.gov. This is a public site. If you take, and I took this screen grab last night, this shows you all of the current regulatory actions that are under review by the federal government. There's a star above Health and Human Services, which again governs HIPAA, okay? But take a look at the total pending actions in the government right now. Now this fluctuates week to week, day to day, month to month, right? So take a look at this site, but there are 16 regulatory actions that are under vote right now and currently being reviewed. Every single action that gets implemented, especially around HIPAA, right, or some other type of regulation, has a trickle-down effect, which means that you need to update policies, procedures, potentially personnel. You definitely need to change and modify technology configuration, applications, network, etc. So that's why this is such a significant problem, because the rate of change around regulation is not slowing down either. So you have cyber attacks, you have this large tsunami of cyber attacks impacting the industry and now impacting the supply chain. And now you have ongoing churn and updates of regulations that you have to deal with. There's some great research and technology out there around regulatory pressure points that most organizations struggle with, or they're trying to get their arms around. And it starts with really increased integration and improved operational resiliency around your cybersecurity program. Oftentimes, organizations are dealing with old risk assessment or old risk-based models that they've been using that need to be updated. And again, they don't have the time or the personnel to update those things. Oftentimes, organizations struggle with making sure that the close partnerships and the relationships that they have within the industry are adhering to regulatory compliance and security and data privacy best practices. There's a focus on modern technology resilience across all of your applications and systems, and we covered some of this on the last slide, so I'm not going to review all of these, but making sure that organizations can deal with these regulatory pressure points is something that needs to be focused on. And I think the underlying thought around this slide, just to summarize it, is, look, a lot of organizations have technical debt, and they have older processes and procedures, controls, and policies and procedures. And the technical debt is a term in the industry that means you have older legacy technologies that are holding your business back or that are creating risk within your organization, and you need to try to remove the debt, re-architect technology systems and applications and IT services, and then deploy new systems that aren't holding your business back, and at the same time, rolling out some type of cybersecurity risk and compliance program internally. And again, just to cap it off, the average loss of a ransomware attack reported increased from $400,000 in 18 to $783,000. And the reason I bring this up is because healthcare and the healthcare supply chain has been decimated by ransomware for years. Here are the compliance realities in healthcare. Healthcare spends about $39 billion annually on the administrative aspects of regulatory compliance, not technology, just the administrative. Care providers with about 161 beds pay on average about $7.6 million in compliance administrative costs per year. Estimated annual cost of regulatory compliance for the average care provider or hospital is about $47,000 per bed. And depending on the metrics in terms of churn and bed usage, that could be anywhere between $1,200 per patient up. The number of regulations for acute care providers over the last couple of years has grown to 629, which is over 288 more regulations than there were a few years ago. The report by Ponemon Institute found that the average cost of compliance within organizations was about 5.5 million overall globally, but meanwhile, the average cost of non-compliance, including remediation, fines, assessments, etc., new technology investment, was about 14.5 million. So the growing number of state and international privacy regulations. We talked about GDPR, right? Which is the EU's version around data privacy for EU consumer data usage. California Consumer Privacy Act is a state-level statute intended to enhance privacy rights and consumer protection for residents within California. Now, we also know the New York regulation calls for the same type of data and consumer privacy acts. But if you take a look at what we've experienced in 2020 in terms of healthcare-focused cyber attacks, et cetera, as we get into this next portion of the conversation, I think you'll begin to see like the severity of these attacks and actually what we're dealing with. So this is a fake COVID map that was published on the internet, right? And this fake COVID map went up literally within weeks of the pandemic. It was set up by hackers and by cyber criminals. And this website, once you hit this website, if your computer or if your device was unprotected, it delivered malware to your device. You had a number of fake or fraudulent or counterfeit drugs that were being sold, and vaccine and test kits that were being sold through various malicious websites. And these websites captured your medical information, your medical records, etc., and they sold that information on the dark web. We had misinformation, significant amount of misinformation on the internet. So these were message boards that were related to COVID, and they basically were spreading misinformation, but they were also spreading malware and malicious code. And then you had basically scam advertising. So you had a lot of advertising and a lot of links for vaccines, for treatments, for care that basically routed you to either malicious websites or that stole your information and sold it on the dark web. So there's a significant amount of fraud, significant amount of misinformation that hit the internet and hit us globally, as well as attacks on the supply chain, on clinics, on R&D facilities that were trying to develop vaccines. If you take a look at what we're dealing with ransomware attacks in 2021, and this is a report that was published a couple of months ago by the Health and Human Services Organization, the security program within the federal government. So this report tracks all of the notable incidents from a ransomware perspective, not from a data breach, but from a ransomware perspective in 2021. So as of January to May 25th, right, 59% of those ransomware incidents were within the US, 41% non-US. So they tracked a total of 82 ransomware incidents impacting the healthcare sector worldwide. And again, from January 1st to May 25th. Very interesting attack information. If you look at the 82 incidents, there were a significant number of incidents targeted at health and medical clinics, healthcare industry services, so third-party services to support clinics and care, hospitals, pharmaceutical, and then elderly care. As you get deeper into the information, right, you see some other additional bits of information about who was being targeted, how frequently they were being targeted, et cetera. And again, we'll provide a link to this research report, well, within this deck when we circulate it. But California, by far, was the most targeted and impacted organization, right? 12% of all ransomware incidents that the federal government was tracking. Therefore, this year within California. So if you're operating a care facility or providing care in California, or if you're part of the supply chain, if you're a business associate, if you're providing goods and services or devices to the healthcare industry, just be aware you're a target. Now, there have been some changes in the HIPAA regulation and laws around ransomware. A number of years ago, if you were in healthcare, dealing with healthcare related information, and if you were held for ransom, that did not constitute a data breach. Those laws have changed. If you are now infected with ransomware, which is a piece of malware, okay, and you're operating within the healthcare industry and you're dealing with healthcare related information, you must report that as a data breach. Okay, so again, why did they change this? Well, this is why. If you take a look at the information and the data within the report, 72% of the ransomware incidents resulted in patient information being leaked regardless. So even when you pay the ransom, they're still linking or selling or distributing that electronic health information, that patient health information. So cyber attack trends and realities, we've talked through some of this, but in 2020, 239 million attempts targeted at healthcare. Hundreds of healthcare facilities were hit last year by ransomware. They were attacking cloud providers, service providers, MSPs alike with ransomware. And I know in one instance, an organization that was supporting about 400 clinics got taken down, and the data from those clinics got stolen. The reality is this isn't just a US problem. This has been impacting healthcare organizations globally. So France has committed to boost their cyber defenses after their hospitals and their supply chains have been attacked and taken down by malware. Millions of medical images have been exposed based upon security and data privacy flaws. And we're starting to see various ransomware variants or strains of ransomware that have been purposely developed and designed to penetrate healthcare providers as well as BAs emerge in the marketplace. And the federal government is beginning to get aggressive about issuing ransomware advisory and recommendations on how to address this. The reality is there are billions of records, consumer PII information that have been breached since the beginning of the year. And what's worse in terms of escalation is the ransomware gangs and the criminal syndicates are now extorting ransom payments, meaning that if you're it doesn't really matter what industry you're in, but if you're a healthcare provider or if you're a BA, if you're a supplier to the healthcare industry, and you are impacted by ransomware and you're held for ransom, if you don't pay that ransom, there's a high probability the criminals will email and call. They're physically calling your vendors, your suppliers, and your customers and alerting them that you are being held for ransom. So this is escalation. This is what we're calling escalation. So again, organizations need to be thinking about, how do we proactively get ahead of this? How do we proactively get ahead of regulatory compliance? And again, this isn't new. This isn't, well, this is all because of the pandemic. 24 to 36 months ago, I was presenting this exact slide. This slide hasn't changed. Okay. This was a screen grab of all of the various healthcare related data breaches and attacks, and this off of a website. And this website went on for days. Like, this was pages and pages of attack examples. But think about this, right? So look at the dates on some of these images, if you can see them: 2018, 2018, right? 2019. So again, this was from a few years ago. So the P's relate to a phishing attack. The R relate to a ransomware attack, and the V relates to a vendor or supply chain or a BA attack. So again, the supply chain within healthcare has been under attack aggressively for years, and it's not slowing down, it's getting worse. Take a look at the data breach costs based upon 2020. Healthcare, the average cost of a data breach, 7.1 million in healthcare. You're at the top of the list. What are they stealing? Customer PII. Oftentimes they steal secrets, intellectual property, etc. If you take a look at just this year in California, the Scripps Healthware attack, ransomware attack, took down Scripps Health. Last month, Scripps Health reported it's probably going to be about 113 million to address the attack. Let's talk a little bit about HIPAA. Here's the realities around HIPAA. Title II, there are 245 different controls. And when I say a control, every time I say a control, a control is related to a policy or a procedure that's related to something within administration, within operations, within technology, or physical security. So if you look at the privacy rule portion of HIPAA, there are two privacy safeguards: use and disclosure. And again, use and disclosure, what are your policies, procedures, and what are your controls, operational controls around PHI use and disclosure? When you look at the security rule, which relates to electronic patient health information, you have administrative safeguards, you have technical safeguards, and physical safeguards. So if you think about this, right, there's 245 rules, and every rule has a control that maps back to a policy, procedure, and a technology stack. Small and medium-sized organizations don't have the resources and the capabilities to really maintain this compliance program and stay ahead of all the changes that are coming. So this is a significant amount of work to do. And again, just reminder, right? Based upon the reginfo.gov website, there are 16 current actions that are under review that will change and trickle down. So here are the realities that we're dealing with around HIPAA compliance. You have growing penalties. So the penalties are based upon a violation type. And you have violations where the individual didn't know, or they didn't exercise reasonable diligence, that he or she violated the HIPAA rule. HIPAA violation due to reasonable cause, not based upon neglect. And then you have HIPAA violation based upon willful neglect, okay? And it's not corrected. So as organizations go through assessments and they begin to go through remediation and they begin to put controls and policies and procedures in place, one of the things that an auditor will do when they come in, they will audit and assess and review those 245 controls. And if there are gaps or holes within those controls, what they will do is they will look for um, reasonable diligence, and they will look for, did you put forth and can you prove that you are remediating and addressing, and there was corrective action performed. Okay. So it's not just enough to have a policy and procedure in place, but if something happens, you have to provide evidence that there was corrective action, and you need to store that evidence, you need to be able to track that evidence, et cetera, or else you have various civil penalties, that you have minimum penalties, and then you have maximum penalties. And most care providers aren't just concerned with HIPAA. Most care providers are taking credit cards. So there's some level of credit card information or credit card data that they need to be concerned with. Now, so a lot of organizations that go through HIPAA assessments or audits, they also have to go through some level of PCI, audit, attestation, or assessment. So there are various violations associated with the different type of violation types within PCI as well. And some of these violations are significant, right? If you're a merchant level 1, merchant level 2, right? And depending on how many months the violation is not remediated, those fines begin to get compounded. So again, this is a significant risk to the business, and it takes a significant amount of resources to try to manage and proactively get ahead of this. Now, if you look at over the last 10, 11 years, growing number of penalties for violations. So you have increasing enforcement, and you have increasing fines and penalties. Now, we don't have the 2021 stats yet, but we'll update the deck and the presentation, and we'll circulate that when we have that. And again, this is posted on the HIPAAjournal.com. So take a look at that website. It's got a phenomenal amount of this information on it. Here are some proactive cyber and IT best practices that other healthcare organizations or BAs that support the healthcare industry are moving forward with. Number one, there are some things to recognize that we've been talking about here. Hacking the human works, phishing, social engineering, business email compromise, fraud-based emails, they work. And actually, those attacks have been growing in frequency and growing in global damages, compounding every year for the last 3 years. Ransomware and malware attacks are pervasive, not just across this industry and its supply chain, but a number of other industries. And once breached and infected, the attacks actually increase. Why? Because the criminal syndicates and the hackers on the dark web talk. They have exchanges and marketplaces and blogs, right? They have these secret communications where they share, hey, this healthcare provider or this supplier to the healthcare industry, we just broke into, or we just held for ransom. They're vulnerable. So it's dogpile on the rabbit. That's actually what happens. And no one is too small, because the way these attacks are working is these cyber criminals and the hackers use the cloud and use the dark web and use automated scanning devices to look for vulnerabilities within your network, and they launch massive amounts of phishing and social engineering attacks on the healthcare industry and other industries daily. And it's 24/7. So how are organizations trying to get ahead of this? Well, we recommend organizations focus on the 4 Ps, which are people, program, patching, and passwords. At the core of this, organizations need to identify the crown jewels of the entity. And within providers, right, those crown jewels are patient health information, patient health records. So how are you encrypting, storing, consolidating, and how are you providing privacy controls around that data? Educate your employees so they understand about attacks, about risks, and running an organization or an employee population, which could include contractors and 1099s, through a security education training and awareness program is great. But if you only do that once a year and you only train somebody 1 hour out of the 2,080 man hours there are to work every year, you're missing the boat. So discover your assets, run scans, or leverage a partner that can run scans to identify the assets that are on your network and what assets have critical vulnerabilities. What assets need to be patched, need to be updated, or need to be set aside or partitioned off and put onto another private network or a more secure part of the network. And then move forward with hardening your systems, your applications, your websites, which before you do that, you would need to attest, scan, pen test, and do a security assessment on those application systems and websites. As you begin to move forward, you evolve the program. So again, focus on people, train, educate, fish consistently. So have a continual program that does this, and then incentivize. We find a lot of organizations building cyber hero programs or compliance hero programs where they're incentivizing or spiffing or bonusing people that go out of their way to point out and address security risks or that help the organization to remediate security risks or data privacy and compliance risks. Focus on data privacy. There are a number of emerging technologies out there that are data vaults, and most of these are software as a service technologies that are out there, whereby you can take all the PII and the PHI information and electronic information that you have, encrypt it, put it in a vault, and then provide consumers or your supply chain access to that so they control what information they want you to have and how that information is actually controlled and disseminated. That removes your organization out of the line of fire. It moves the risk to the consumer or the responsibility around data privacy to the consumer. And it gets your organization out of the middle of that. So again, there are some very interesting technologies out there to investigate. Brand, I can't communicate this strong enough. Organizations need to understand what their risks are and who's trying to penetrate them and who's trying to break into the organization. And you can do that through penetration testing, risk assessments, logging and monitoring your network, your systems, and your devices. And then I think we mentioned this earlier, your third-party partners, vendors, supply chain, your BAs. There are a lot of tools and a lot of organizations out there that can actually provide a third-party partner or a vendor assessment through some type of web-based tool. So you can assess them based upon their risk, their cyber and their compliance risks, and then create a scorecard so you know which vendors are more susceptible to an attack and where your risk is within your supply chain. If you don't have the time, money, resources to do this, identify a trusted partner. Talk to an organization that understands endpoint detection and response, so anti-malware, encryption, anti-ransomware technologies. Talk to a partner who understands how to do managed threat detection and response proactively, and then work with an organization that can provide security or compliance as a service. There's a little bit more information and guidance around the 4 Ps. Again, you can plug into our webinars, some of our ebooks, and other white papers that we have around this, but start with your people, focus on your program, and your program at its core should be built around data privacy and protection. And then you layer in that monitoring, detection, response policies and procedures. Here's some additional guidance, technical guidance and remediation. And one of the things that I'll point out is if you have a business continuity and disaster recovery program or a document that you've already created around that, update it with a ransomware, phishing, or business email compromise attack scenario. Because it's not a matter of if, unfortunately, it's a matter of when one of these attacks will break through your defenses. So update your business continuity and disaster recovery plans with those scenarios. Here's a compliance solutions map. I won't spend a lot of time on this, but if you're a small to medium to large organization that's a covered entity, then these are typically the regulatory requirements and the business drivers that you're trying to address. And these are common cyber threats and attacks. that you're going to deal with. The last portion of this image talks about potential security and compliance solutions for you to look into. And then again, if you're a business associate, right? So you're biotech, pharma, business services, supplies, maybe you're doing manufacturing for the industry. You have a broad number of not just industry, but federal level of regulatory compliance oftentimes that you need to adhere to. And here are in the middle the common cyber attacks and threats that you need to deal with. And again, same thing. You have a number of different cyber and regulatory compliance options and solutions for you to look at. Cisco is a great partner of ours, and they've done a significant amount of work mapping HIPAA and the regulation back to their architecture and their products and services. So this is a fantastic guide. Disclaimer, it is a few years old, and I know that they're updating it, but this guide talks about how do you deploy a technical HIPAA framework and architecture within your organization that addresses the endpoints, the medical devices, applications, and your physical security, technology and an architecture that addresses your administrative, so authentication, access control, management, encryption, and ongoing monitoring, and then your infrastructure, and not just at the care facility, right, at the hospital, but at the data center, at the clinic, at the edge, right? So network routers, switches, security, et cetera, and then the underlying services required for this. This is a great framework and it's a great guide. It's hundreds of pages long. It has a large amount of network topologies listed out, but it also lists, if you're concerned with a security function or a compliance function around HIPAA, like physical security, identity management, authentication, logging, auditing, and monitoring, it maps the Cisco solution to that requirement. So this is a fantastic document. As you go through this document, what you'll find is they lay out, hey, from a hospital and a clinic service type perspective, these are some of the common services within healthcare providers and clinics. These are the controls that are recommended that you adhere to based upon HIPAA. And then here are the relevant solutions and products that Cisco has. So again, it does a really nice job of mapping this out. And of course, we're a Cisco partner, so we can help organizations navigate through this so they're not overspending money, right? But they're getting the appropriate level of coverage that they need. And then deeper into the document, Verizon actually did a third-party research report and analysis on Cisco's architecture and portfolio. And basically, I'll summarize it. So there are 9 different sections that make up HIPAA Part 164, Part C, and Subpart C. And within this section, 3 of those sections are administrative, and they weren't part of the Verizon assessment and review. Okay, the remaining 6 sections included security standards, general rules, administration safeguards, physical safeguards, and the technical safeguards, as well as organizational requirements, policies, procedures, and documentation. So again, as we discussed on that previous slide, significant amount of work and effort associated with trying to adhere to HIPAA. Now, after they performed this initial assessment, of the 52 safeguards in the current healthcare requirement, Verizon identified that 29 safeguards weren't really applicable, could not be addressed by Cisco. Now, again, this is a couple of years old, and Cisco has continued to evolve and develop their portfolio, and they've bought a number of security companies and other technology companies. So their portfolio has changed. But what they found was, out of the remaining 23 safeguards, there were 8 specific safeguards, right, where Cisco security controls were universally applicable, and another 15 safeguards where Cisco's technology was specifically applicable. So again, really nice body of work here. And within the report, they actually list, here are the technologies and here are the products where Cisco's technology is either universally or specifically applicable to HIPAA. Now, I already mentioned this, but things to keep in mind. Most healthcare organizations and organizations within other industries that are concerned with cybersecurity risk and compliance are looking at what's called a zero trust security model, which really revolves around how do we ensure that we have multi-factor authentication in place. So if somebody accesses the network or gets access to the network, and on that network is holding some level of PII, personal identifiable information, or patient health information, that individual that has access actually has the right credentials to access. And they can only access certain pieces of information based upon their access rights. So there are a number of technologies that Cisco has within their portfolio that map back to zero trust technology architecture. So, and it spans from dual factor authentication, to Umbrella, to Threat Grid, Stealth Watch, Firepower. So there's a large number of technologies, pieces of software, appliances, etc. But what this slide is doing is it's communicating that these portfolio enhancements that Cisco has made help organizations to rapidly improve their cyber hygiene and their cyber and their compliant program maturity. So even if you're at the most basic level, which is level 1, or right, you're striving to be at a more proactive security level, this is how those platforms, technologies, and software components help you get there. Now, how does Exceptional help with this? Well, we architect, design, implement, we can run, manage, and maintain technology infrastructure, applications, communication platforms, telephony, cloud environments, etc. for organizations. So we have a wide variety of services and solutions that we offer, which begins with Exceptional Care, and that Exceptional Care line is a managed services line. We have Exceptional Connect, which really focuses on video, voice, web conferencing, and communications. Exceptional Cloud, which focuses on enterprise class and regulatory compliance cloud environments, where you might want to put applications, data, backup, recovery solutions. Maybe you want to virtualize the environment or move workloads from one environment to another. And then we have Exceptional Networks, which is really focused on technology solutions around the network, hardening the network, updating the network and the connectivity across not only your care facility, but also your supply chain. So I'm highlighting or circling very specific solution areas within these portfolio elements. A lot of healthcare organizations are looking for backup and recovery solutions. And whether it's a business continuity plan, it's a disaster recovery plan, they're looking for a more cost-effective and a more seamless way of deploying backup and recovery. Why? Because in ransomware attacks, one of the first things they do is they identify your backups on your network and they encrypt your backup. So they take you down and you have no backup if it's on network. So a large percentage of healthcare organizations are moving backups to the cloud. So we can help in that area. We have a compliance as a service solution. So we actually help organizations to run, maintain, and update their regulatory compliance. And then we have security solutions and security as a service offerings. So when you tie all of those things together, managed services, backup recovery, compliance as a service, security as a service, we can customize, we can create a number of different options for organizations. We're trying to get ahead of this and trying to deploy some of those proactive strategies around those 4 Ps. So if you think about what we're really offering, support and monitoring services that are lights out on all of your entire environment, okay? We can provide comprehensive blanket support for security, HIPAA, CMMC, PCI, managed compliance services. And then if you need virtual CIO, virtual CISO, regulatory compliance, architecture design, program development, we can provide that as well. One of the new things that we just announced a couple of months ago was a new compliance manager, compliance as a service offering. And within that offering, we have a HIPAA Compliance Manager Program. And this provides a HIPAA privacy rule worksheet, all of the software we install, we manage the software, we maintain the software, we perform assessments and reviews of your HIPAA program. And then this software actually includes tools, templates, policies, procedures. And then we provide support to make sure that your HIPAA controls and your policies and procedures are in place and they're being updated. So fantastic program that we've introduced. I'm just going to wrap up. Most healthcare executives or business associates and suppliers that we speak to are seeking ways to reduce the risk around cyber attacks and improve employee safety, patient safety, and employee productivity. At the same time, they're also looking for highly efficient and effective ways to address regulatory compliance while they support patients and consumers or customers. The reality is the amount of time, energy, and effort and resources required to align your IT systems, applications, your business processes with regulatory compliance, whether it's HIPAA, PCI, GDPR, CCPA, etc., it's significant. And most organizations struggle to do that or they're looking for help with that. Good news is you're not alone. So as a leading award-winning provider of managed IT services, networking, and security and compliance solutions, Exceptional is committed to helping the industry to reduce risks and align their IT systems and applications to address regulatory compliance. So we work collaboratively with you to deploy effective and efficient IT solutions and IT services that will support the current needs of your organization, as well as your patients and your suppliers. So we ask that you embrace the Exceptional experience and visit our website or contact us today. We want to thank people for attending this conversation. Check out our resources page for additional research and ebooks. And then if you want a complimentary network or security or compliance assessment, reach out. We'll be happy to speak with you. All right, with that, again, thank you very much for attending. We appreciate everybody's time today. Thank you so much for the feedback. We'll look forward to talking with you soon.